have done my RFP on Pathways Housing First. Addiction among the homeless is a serious problem. These are typically the hardest to house and are the least likely subgroup of the homeless population to gain access to housing programs. Turned away by programs that demand sobriety, many people with these problems have spent years on the streets. Homeless individuals who have substance addictions make up an extremely vulnerable population. These individuals face troublesome consequences, including acute and chronic physical health problems, exacerbation of psychiatric symptoms, and a higher likelihood of victimization and incarceration. We need to be actively seeking a new way of looking at how we house chronically homeless individuals that suffer from addiction. There's an urgent need for evidence based, clinically appropriate shelter with daytime recovery supports. A bed without the appropriate services is simply a bed, and that will not support people on the pathway to permanent housing. Innovation and evidence. Pathways to Housing, a nonprofit agency in New York City, developed a supported housing program to meet the housing and service needs of homeless individuals who suffer from substance use disorders. PHF is an evidence-based practice which is based on the principle of client choice and offers housing as a basic human right to people with substance use disorders. The program is designed for individuals who are unable or unwilling to obtain housing through traditional housing programs. 80% of the participants in a federally funded study assigned to PHF were in stable housing after 12 months compared to 24% for the traditional continuum of care housing programs. PHF maintains an 85% housing retention rate with individuals not considered housing ready by any other program. Data in the applicability of housing first models to homeless persons with serious mental illness. That particular report indicated that Pathways to Housing clients had the greatest level of housing stability, with 62% remaining in housing for a full 12 months. The proposed activities for clients are being assessed for program eligibility, attend money management programs, get intensive care, case management, and assistive community treatment, see a physician, and substance use treatment activities. Activities for the staff include outreach, securing government contracts, billing Medicaid, solicit for private contributions, apply for grants, trainings to manage housing and other intensive supportive services, and to provide compassionate care with a social justice lens. They also assess consumer housing preferences, obtain rentals, supplements, and assist with apartment furnishings. In 0 to 6 months, clients have access to client-centered interests, participation in addiction treatment, reduced contact with non-supportive networks, access to community mental health services, access to public benefits, housing, and collaborative care from ACT or IMC. In 6 to 24 months, clients have increased their desired activities and employment. There's a decrease in problematic drug use, increase in community support and social integration, and an increased number of days housed. In 2 to 3 years, clients have a decline in healthcare costs. There's a decrease in costly services like incarceration, hospitalization, and ER visits. There's an increased use of primary care doctors and an increase in the accusation of long-term permanent housing and an increase in quality of life. The budget for Pathways Housing First is about $418,000 a year, with $223,000 of it going to administration and related expenses, $120,000 in housing. It's about $77 a day per house client, which equals $28,000 per house client annually. I am asking $400,000 over a 5-year time, which is added to other funding sources. Evaluation is performed by performances assessed through electronic records, self-assessment data, and program satisfaction surveys. Clients' housing outcomes, income, service engagement, and utilization of emergency services are captured through administrative data. Indicators of well-being, including level of mental health distress, substance use, and social connectiveness, are collected via peer review measures. A fidelity measure that captures whether the key ingredients of a program model are in place is an important tool for successful implementation of an evidence-based practice. The fidelity scale is designed to guide service organizations such as Pathways to Housing First in their implementation of the practice by focusing on the processes of organizational change and clinical change. Thank you.